Pie charts are another way of evaluating the RNFL circular tomogram. Remember, this tomogram is simply a circular cutout in a region surrounding the optic nerve. That cutout is unrolled and displayed as a single tomogram. It has been well studied in clinical trials, and thinning in this zone correlates with glaucoma. Pie charts are integral to interpreting the RNFL on your OCT. Each eye has two different charts. The first is a quadrant analysis, and the second divides the quadrants into tinier pieces, or clock hours. The quadrant analysis is a good place to start by looking for diffuse changes, paying careful attention to the superior and inferior portions, which are most affected by glaucoma. The clock hour pie is useful to look for focal change. It is here that you can be sure anything seen on the quadrant analysis actually looks plausible to be glaucoma. Let's look at some examples. In this one, we are evaluating the right eye. We can see diffuse changes in the quadrant analysis as denoted by the red background, which indicates statistically significant thinning of the RNFL compared to age-matched controls. As we evaluate the clock hours, we note that the sections affected are superior and inferior, with an overall arcuate direction to the pathology. This combination of diffuse and focal change is consistent with glaucoma. In this example of a right eye on a different patient, again, we see diffuse changes in the quadrant analysis, and these changes are located in a typical superior and inferior location. But when we move to the clock hour analysis, we note that the sections of statistically significant thinning are along the nasal aspect of the superior and inferior poles, as well as the temporal aspect involving central nerve bundles. Glaucoma does not behave in this manner. It does not preferentially affect the nasal nerves and the macular bundles without also affecting the temporal arcuates. Putting it all together would mean that your index of suspicion for a diagnosis of glaucoma would be low based on this OCT. Are you ready to try your hand on some real images? Join us at eyecarepd.com.